So welcome everybody. It's that time for nowadays it's Friday, so that means Revolutionize Your Marketing. John Petros Sr. Um that we do right here every Friday at 5 o'clock p.m. Eastern, 4 o'clock Central. And so without further ado, bring in our host. Hi John.
How you doing, Emily?
Good, how are you?
And thank you, folks, for joining in this week. I do have a duet coming into the show tonight. So welcome to Revolutionize Your Marketing. I'm John Petros, and I'm the owner of Mill City Marketing MA, where I do help businesses grow by getting their brand known across social media, radio, and TV. So let's bring our guests in. We have Scott Hess and Scott,
Hello, sir. Thank you
and
for
we
having
have
me.
Cymona. How we doing, folks?
I'm doing great. Yes, thank
Doing
you.
well.
So Cymona, we'll let you introduce yourself first, and then we'll turn it over to Scott.
Well, hello everyone. I'm Cymona Elliott, and I am a retired teacher of over 20 years, and I love helping people. So I found EHP, and I am currently working with Scott Hess, and just to help get this information out to different businesses, and hopefully we'll be able to change, I won't say the world, but change a lot of things going on in the nation. So with that being said, I want to hand it over to Scott.
Well, my name is Scott Hess. I am an agency owner, and I have partnered with EHP for this government subsidized program that we run that I look very forward to sharing a lot more about here shortly.
Great. And Cymona, where are you located?
I am located in Maryland.
Maryland. And Scott, how about you?
I'm in Eastern Washington, about 3.5 hours east of Seattle, and in wine country, agriculture area, cherries, apples, all that stuff for Washington State.
All the good stuff, especially the wine.
Absolutely.
All right. So Scott, why don't you fill us in on what EHP is?
Okay, so like I said, EHP is a government subsidized program, and it's very unique. Essentially, any business that has 15 or more employees, we have a wonderful opportunity to save them a lot of money. So we actually are able to save an employer $640 per employee per year in FICA tax savings. So you have a business with 100 qualifying employees, those employees get enrolled into the program. What that ultimately does is it saves the business $64,000. If you're an employer with 1,000 employees, you're looking at $640,000 in FICA tax savings. Now, one of the other things that's really nice about this is it also provides the employer a way to cut the cost of their health insurance anywhere from 10 to 20%. So, how that happens, I'll tell you about these things a little bit later, but for example, you're going to hear about an opportunity for the employees to get better benefits that make them healthier and happier. And they will receive no cost, no copay, uh, primary care, urgent care, mental health care, and prescriptions. All of those no cost, and then wholesale pricing on weight loss drugs and coaching, smoking cessation, and that sort of thing. So it's really nice for both employer and employee alike. But what this does is we are able to take anywhere from 10 to 20% of the employer's claims insurance. So claims that are going through their medical provider, whether that's Blue Cross, Blue Shield, or they're self-insured. Well, when you envision that we are able to take 10 to 20% of those claims and migrate them to our platform, now those are costs that the insurer no longer has because they've been migrated to our platform. And so therefore, it will either instantly save the employer 10 to 20% if they're self-insured, or it's going to save them 10 to 20% over time on average if they're through a Blue Cross, Blue Shield, Regents, or something like that. So it's a beautiful thing for the employers. They love it. They helps their bottom line. I've done a lot of work with school districts. It's kind of been my lane, so to speak, as late. But this is truly any type of employer. But school districts especially, they're suffering badly from budget deficits. They lost all these COVID funds a while back. So it's really been a boon, especially these rural school districts. All of our offerings are telehealth. So you have these entities that are out there claiming that they offer telehealth primary care. But for example, they're using registered nurses and PAs. Well, every single one of our doctors for our primary care, it's a board certified physician, PhD, that has at least 10 years experience in practice. So 10 years in practice. So licensed board certified medical professionals, our mental health professionals are all clinical psychologists, psychiatrists, and that sort of thing. So on the employee side, like I said, so no cost, no copay primary care. And being telehealth, imagine if you're an employer in a more rural area. Sometimes these people have to drive 75 minutes one way, 75 minutes back just to get to an urgent care facility. Well, with our primary care, you might contact your doctor. And like me earlier this year, I was told, okay, we're 6 weeks out. I just needed some labs done. 6 weeks is a good chunk of time to wait.
Yeah.
But that's my primary care doctor. I didn't have any choice. So I sucked it up and waited the six weeks. Through our platform, basically 100% of these appointments are scheduled in 10 days or less, 90% in 3 to 5 days. So it's very nice in terms of, time. For the urgent care, it's even better. I have a great example. When I went to a Albuquerque, New Mexico conference. So it was a law conference down there in Albuquerque. And this was just about 2.5, 3 weeks ago. Well, the morning of my flight, I woke up sick as a dog. I felt horrible. I was wheezing in my chest. I was coughing my head off. It was terrible. So at the same time, I didn't have time to deal with anything. It's too early to go see anyone unless I want to go to ER, and I didn't have time for that. I had to get to the airport. Well, once I landed at my layover in Salt Lake City, I got into our app, and 15 minutes later, I was talking to a PhD. I was talking to a doctor. So this was the urgent care. So 90% of our urgent care appointments, they happen in 10 minutes or less. It's lightning quick. So it's really nice. Even better is the doctor said, okay, this is going around. It's very common right now. It's viral. This is not going to be anything bacterial. So it doesn't do any good to give you any type of antibiotics. So what you're going to want to do is take this inhaler, take this steroid, and take this cough medicine that I'm giving you. Tell me where your hotel is in Albuquerque. I told him, and when I landed in Albuquerque, I already had the medication waiting for me at Walgreens. No invoice, no receipt. I walked in, I showed them my little discount card, which the discount is 100%. So it was free. Again, no cost, no invoice, no receipt. Grabbed my meds. I was out the door. So it was super awesome. We have tons of stories like that. The mental health care. This is something we're actually really, really proud of, because on the mental health side of things, depending upon the state that you live in, the average wait time to be seen by a psychologist or psychiatrist or mental health professional of some type, it's anywhere from 6 to 12 weeks. That's terrible. In the state of, I think it was Maine, we were talking to a school district earlier this year, and they said for their middle schoolers and high schoolers, there was a 6-month waiting list to be seen. So, I mean, that's just horrible. Well, with ours, we actually have an 88% attendance rate to first appointment, because the appointments happen so fast. The average is 3 to 5 days instead of 6 to 12 weeks. So the average attendance rate to a first appointment in the mental health industry, it's in the low 30 percentile. I think it's like 34% or something like that. So us 88%, them 34%. So there's also a really, really cool platform that we have. It allows people to attend group calls anonymously. A lot of people stigmatize mental health or embarrassed to admit that they're getting it or otherwise. And so, if you've never done it before, it can be a little bit intimidating. So with our platform, you can get on there. You can see a psychologist leading something on a particular subject, maybe divorce or separation or something for kids, children of parents dealing with divorce. In other cases, we even have financial health type of things where they can get on with a certified accountant. So it's not just going to be health related. There's hundreds and hundreds of different categories. This allows them no picture necessary, no video necessary, anonymous, random username. They can go in and attend anonymously and kind of dip their toe in the water before they jump into the pool. And then finally, on the prescriptions, love the prescriptions. It's awesome. So I'm someone on statins. So it's hereditary. I'm a marathon runner, but I have high cholesterol. Imagine that. So I have to, take my rosuvastatin, and it's great because before I was paying $30 copay every single month. Now I go to Walgreens, show them the card. Well, I don't even have to show them the card anymore. It's in the system. They just hand me my drugs and I go. So that's true with allergy medicines and antibiotics and other things. So the other, with the prescriptions also, it's free shipping. So they can either go to the pharmacy, pick it up like I do, or they can have their drugs. If it's a maintenance medication that they take every month, refilled every month, it can just be shipped to their door, no charge. So free shipping. And so it covers over 1,000 of the most commonly prescribed drugs in the United States. So roughly 85% of the most commonly prescribed drugs in the US, we offer them. No cost, no copay. Covers over 70 acute medications as well. And so we do own 3 of our own pharmacies. So 3 compound pharmacies that we own. And as far as I know, I believe that we are the only entity that actually is proprietary and has everything under one roof. There's a lot of, people, not a lot, but there are competitors, I should say, where they have similar offerings. But imagine having 3 or 4 different apps on your phone. Oh, you want urgent care? Go to this app. You want primary care? Go to this one. You want mental health care? Go to that one. So with us, everything proprietary, one roof, one app. We own 3 compound pharmacies, and they can even put special medications together based on need or by request. So the prescriptions are wonderful. I personally love that one. And then the weight loss. So weight loss coaching, weight loss drugs. If you go get a first consultation somewhere for weight loss coaching, probably the bare minimum or cheapest price you might find is maybe $149, $199, something like that. Our first consultation with our weight loss specialist or coach is complimentary. It's free, no charge there. But then they're also going to get access to weight loss drugs at wholesale pricing. So anywhere from 40 to 60% cheaper than what they'll find retail. So employees absolutely love this. But the funny thing is, when the reason that the employer is saving on their FICA tax savings is because the employees are actually saving on the FICA tax savings. So not only do the employees save on FICA, but further, what this does is allows them an increase in take-home pay, because our program will cover a single employee or up to a family of 7. So family of 7 is the same cost as a single person. So the thing is, for an employee to qualify for this type of plan, there are qualifying factors. It has to be a W-2 employee, so it doesn't count for 1099s or independent contractors. They also have to have ACA qualifying health insurance. So that's the other thing. The employer has to be offering the employees health insurance because this is a supplemental benefit. It's truly supplementary. It does not replace, compete, or conflict with any existing benefits they have. It's designed to stack on top of, truly supplement anything they have. So designed to complement and enhance existing benefits, just making them better while lowering the cost of health insurance and saving employer and employee alike. So employees actually see an increase of take-home pay, anywhere from $1,000 to $3,000 a year. So that's nothing to sneeze at either. So because there is a pre-tax deduction and a post-tax credit within the same pay period, this allows the employee to get a FICA tax savings through what we call SIMRP law. SIMRP is SIMERP, stands for Self-Insured Medical Expense Reimbursement Program. And so basically, it's an integrated IRC Section 105 plan that provides employees with comprehensive medical care and wellness services while creating significant tax savings. So kind of think of it as a smart way to get additional healthcare benefits that work alongside existing health insurance. So how it works is a SIMRP operates as a service-based supplemental medical care program that enhances your existing employer-sponsored group health insurance rather than replacing it, excuse me. So it's essentially through an integrated structure combining federal tax laws. Employees make a monthly pre-tax salary reduction through that Section 125 cafeteria plan. So it reduces their taxable income. We're 100% compliant with ERISA, ACA, IRS, and HIPAA rules. And at the same time, they receive these tax-free reimbursements for the fair market value of actual medical care and wellness services for that matter. And that's provided through the integrated platform. So these services include virtual primary care, like I said, all the other things. But the beauty of the SIMRP is that it creates substantial tax savings for employees while providing employers with significant payroll tax savings, all while delivering valuable medical care services that supplement their existing health insurance coverage and help them to stay healthier. So that's kind of the mile high view, what I got for you for the time being.
Wow, that's a lot. It sounds like it's everything anybody could need all in one place, which is awesome.
Yeah, I
Sounds
really
like a really
consider it
awesome
the ultimate
platform.
win-win. I mean, when you're able to help employers save money and you're able to increase take-home pay, improve benefits, have employees get healthier and happier, it's really a win-win. And it's big win for agents like Cymona because it's a very well-paying endeavor as well for my agents.
And how many employees does the business have to have? 10?
Yeah, so I said 15, but you are correct. The number is 10 qualifying employees. The thing is, if you have 15 employees, you might have 13 of them qualify. A couple of them might not qualify for a variety of reasons. And then of those 13 that do qualify, maybe 2 of them opt out. So you only end up with 11 because of the employees that qualify, it's anywhere from 85 to 90% on average actually enroll into the program or stay up to date.
Okay. I understand. Okay. Yeah, that makes sense. Cymona, where do you sit in this whole process?
I am literally working along with the company to get this message out, literally as an agent. So when you and I had this conversation, I felt that Scott would be good to come and really give you some really detailed information. So everyone sets the
Yeah.
appointments. Anybody that needs to see Scott will come through the agents and we will just put them on the calendar. So if you have anyone that would be um, open to the interview to qualify, we would set them on Scott's calendar.
Yeah, and by the way, it's not really an interview. It's what we call a discovery call. So if there's an employer out there and you're interested in getting on my calendar, all you would need to do is email scott@healthlegacyllc.com and be sure you mention Cymona. So just put Cymona in the subject line or something along those lines. Mention it in the body of the message. Either way is completely fine. And so scott@healthlegacyllc.com. And it takes me about 25 minutes to do this discovery call, walk you through the information, show how and why it's compliant, the tax code that we count on. So that's, like I said, 25 minutes usually takes me for that discovery call / slide deck presentation. And then after that, I'll stay on the call for as long as you need to answer any questions you might have.
John, can I say
Okay.
one more thing? But
Yeah.
and Scott would agree with this as well. What is the most, and I said this to you before, the highest cost item in the United States is what?
Health insurance. Yeah.
Healthcare. Yes. So therefore, I really stand by it 100%. I don't really talk about things that are not going to make people well and better. So it's very
Yeah.
preventive maintenance, which we need to be looking at as opposed to having to go to the doctors or whatever, that we would take care of ourselves before that point. And I think we'll get more years on our life in a better way, because you want to get older, but you don't want to have to be limping or this and that and the other. So this
Right.
this is what attracted me to EHP, which by the way stands for Essential Healthcare Plan. So yeah, we
Right.
just I really think that Scott is whenever he does the presentation, it's just awesome. He gives the details, but doesn't linger on with it, and you get the information. So it's really good.
Yeah. He does a really great job.
Yes.
A lot of
Yes, he
information in
does.
a short time, but
Exactly.
Drinking from a
um,
fire hose.
but
Yes.
then again, if anybody watching this doesn't get all the details, you can turn around and watch the replay of this video on my YouTube channel. Simply go to YouTube, type in Mill City Marketing MA, and this, along with most of my past um, podcasts, will be there.
Right. Thank you.
And like I said, um, Scott, why don't you give out your email again for them to get hold of you directly?
Scott at healthlegacyllc.com. So health, HEALTH, legacy, LEGACY, LLC.com. And guys, I am actively looking for agents as
Yeah,
well. If there's anyone out there who's interested in becoming an agent, you are interested in very well paying, profitable endeavor, reach out to me through the same email. I'd be happy to talk to you if you have an interest and you have contacts that are decision makers, employers, superintendents, any type of decision maker, director of finance, CFO, COO. If you know any of those types of individuals or something along those lines, this can be pretty life changing from a financial perspective, even for yourself.
I might actually take you up on that, Scott.
Sounds good.
um,
Let's talk.
and Simona, how can people get hold of you if they want to go through
You
you?
can reach me at my email. You can reach me on my email is Cymona, Cymona, Elliott, ELLIOT 61 at gmail.com. And they can just call me. I do answer my phone and I don't really care about that. As if you don't call right, I know how to block that number. So it's 240-640-8873. I just want to let people know it comes up as a scam because you give your number out, but I really don't care because I know how to take care of that. So but again, if anyone should call me and it's a reference to EHP, I will definitely be sending them over to Scott because that's what I came on to do. And to be respectful of the way that the company is run, that's how we do it. We set an appointment with Scott, and then he takes care of the rest.
Yeah, and the nice thing also, John, for agents
Mhm.
like Cymona, it's really great because there's only two things that we count on them for. Number one, you just have to get a decision maker onto my calendar. That way, that allows me to do a discovery call. Really, that's it. And we don't want Cymona going in and trying to explain what I just explained. We want people to go in and tap into their relationships and essentially give that 1 to 2 minute coffee pitch, elevator pitch. And, we don't
Yeah,
want Cymona to be the one trying to answer the question. So she's going to constantly kind of deflect and point them my way. So her main goal and purpose and job, get discovery calls onto my calendar. The only thing that we ask for thereafter is after the discovery call, we collect what's called a payroll census, just a payroll report. Once we have the payroll report in hand, Cymona's done. She'll be paid very handsomely. And so This is very, very simple and straightforward. So get people onto my calendars. It's honestly the highest paid referral program in the entire world.
And that's a duplication process. It makes people know that this is not a tough job to do, is to get people on Scott's calendar. So, and you get paid for it. So there you go. So that's most important. I'm glad Scott brought that up, because if people think they have to say a lot, then they may be afraid to do it, but they really don't.
Yeah. Yeah, sounds like it'd be a good position for me. That's why I'll be getting in touch with you, Scott.
Sounds good. You got my email.
I mean, as you can tell by where am I? This year, I'm an ambassador for Alignable. So I do an in-person networking up here in New England once once a month, and I've been on the platform for 3 years now, and I'm
Awesome.
approaching 3,000 connections.
Beautiful. Yeah,
So,
we could have something there. Let's talk.
and like this one up here, I'm a #1 best-selling author in the book
Right
that
on. Very cool.
this is where I put my little commercial in. The book that came out by a group on Alignable. It's 42 authors in this book. We all tell our story in the book. It's available on Amazon for $18.
Very cool.
That book,
Right.
they put that book together in 3 months,
Oh, wow.
and they're coming out making it a series. The following collaborative books like that, it's going to be categorized. Doing one for women entrepreneurs, veteran entrepreneurs, reinvented entrepreneurs, which is all of us, and yeah, pet business owners. But they just recently came out with a new series that they're doing on top of it called the Expert Series. One of the categories, Scott, is health and wellness.
Very
So
cool.
if you've ever thought of doing a book, Scott, it's very easy. They actually get those books out in about 2 weeks from start to print.
I'm a big writer.
You don't
Oh,
have to
I
be.
do write a lot.
You don't even have to be a writer with the platform that they have.
Cool. Yeah.
I'll actually give you the website to check it out if you
Yeah.
want to check out the books. It's businesswithpurpose.org. They do have a group on Alignable. It's called Business with a Purpose.
With a
And that
purpose,
group
business
alone,
with purpose or business with a purpose.
Business with Purpose.
.com.
Yeah. No, .org.
Dot what?
.org. O-I-G.
Oh, org. Okay.
And they'll have a page on it too where you can see all the authors in all the books. And you'll see my lovely face there.
Right on.
all
But
right.
that's my little commercial time. Um, so, other questions do I have? So, Scott, you said it's in addition to the insurance that employers offer.
Absolutely.
So is a
Truly
supplement,
supplemental.
and it reduces the cost of the insurance that they're paying now?
Yep. Yes, sir.
Okay. I want to ask, can you explain how that reduces the cost of what they have now?
Um, that is the complicated thing. That's actually the purpose of the discovery call. It's a very visual thing. So you actually have to see a paycheck example. And that's probably the most important thing of the discovery call, is actually walking the employer or decision maker through the paycheck process, the paycheck example, and showing the pre-tax credit, the pre-tax deduction and the post-tax credit. Because when you're reducing the employee's FICA taxes under FICA, under CIMRP law, what that does is it reduces the employer's FICA tax match. Every employer is required to match a certain amount of FICA taxes that employees pay. Well, naturally, when you reduce the employee's FICA taxes, it reduces what they have to match. And so it ultimately ends up saving that employee $53.33 per month, every single employee in the program. And that's what equates to the $640 a year. But no, that would be I'd take you down a rabbit hole that would just confuse the heck out of everyone. That's probably the best I can explain it for the time being.
Yeah.
But for someone who's interested, yeah, get onto a discovery call.
Okay. Yeah. Um, we have plenty of time. How many people do you, as far as you can tell, Scott, have accepted this program? What's like the percentage of people that you talk to that actually go into it?
Once we actually have a payroll census in hand, we have a closing rate of somewhere between 75 and 80%. It's very high. So honestly, the biggest objection is it sounds too good to be true.
Yeah, like a lot of things. But yeah, that's that's one thing that I know. That's one way that a lot of businesses that I know of will look at it is this can't be, there's gonna be something fishy with this. It's too good to be true, but apparently it is.
But also in that,
Yeah,
remember, it's 15 to 20 minutes to see if it is true. And why would you give
yeah,
up 15 to 20 minutes to find out if you could offer that to your employees and also make that kind of money? Because if you're a company with 50, 100 employees, you're talking about $640 times that, and that would equal, what would that equal? 64,000 dollars a year if you had 100 employees? Come on, if you don't need it, I can take it. I'm just saying that's more money for the business
yeah,
to do whatever they need to do. And I am approaching another business that they have anywhere from 3 to 500. But think about that. They could take that money and use it for another part of their platform in that business because they don't, right? Am I right, Scott? They don't use
yeah,
that you don't tell them how they have to use that money in their business so they can use it for whatever they need that they may be lacking in. We have another business to say that they could use that money for a school that they could use it to up their school and to get materials and to do programs and things like that. So think about that. It's
yeah,
not one-sided. What are you losing if you don't take the 15 to 20 minutes to talk to Scott? You could be losing quite a bit. Healthcare, supplement,
yeah,
you don't have to pay a copayment. You don't even have to go to the one that you originally have. You can go to this one and you don't have to pay the copayment. And I love not to pay 20 or $30 every time I go to any doctor or whatever.
yeah,
That's kind of,
Yeah,
you
one
know,
simple thing, John, is just
yeah,
you know an employer of some type. Just ask them, would it be unreasonable to give 25 to 30 minutes of your time if I could show you a way to save $100,000, because they have 150 employees or something like that. So,
yeah.
it's not that hard.
And the way my mind works, something just came into my head. Um, I could actually see it, shall we say, use the expression snowballing. The money that businesses save, put it into a marketing account, get a hold of me, in, I can help them increase their business where they have to hire more employees, therefore more employees to enroll in the program.
Absolutely. We actually encourage employees to do that rather than taking their
Yeah,
increase in take home pay and going out to, fine dining or a nice restaurant. Go reinvest that somewhere.
yeah,
exactly.
yeah,
And we're
And
going to
the
have to
other
do
thing
that.
actually is very worth noting. Um, the biggest resistance we honestly probably get is from HR departments. And that's, you can't blame them for that in a sense, because they're thinking, oh, great, we have this new program that's going to be more work for me and no extra pay. But at the same time, we have almost everything automated. We don't need HR's involvement really at all. There's only
Yeah.
one short period of time, basically, when we are doing the employee education, because we take care of all the employee education from top to bottom. And so just when we're doing that employee education, we just want HR to help us by nudging the employees like, hey, check out this webinar, go to the website, read that material. We're going to send direct mail to them, direct mail pieces. They'll have an exclusive website for their business. So HR departments need not worry or fret either. We're not going to become a dirty word in their office.
Yeah. One thing you could tell HR too is, hey, if you think it's more work for you without getting paid, enroll in the program and you'll get more in your pay.
Exactly. That's what I was thinking. Exactly. That's what
Right?
I was thinking. Their
Yeah.
pay goes down. Their pay, it helps their pay too.
Yeah. Good point.
Mm-hmm.
It helps them out too. So you're not putting in work and not getting paid for it. You are getting paid for it in the end.
You're right.
See? That's what I do. I help people.
Yes.
But so um what else can we I'm losing my train of thought here. I keep getting off track. Um
Hey, John, just to let you know, I'd mentioned to Cymona, I don't know if she passed it on to you. I do have essentially a hard stop at 2:45 because I do, and that's Pacific time. So it's about 7 minutes from now for me because I have another call that I have to
okay.
do.
Okay. We can end it then. That's 45 minutes. That's fine. Um Emily, do you have any questions? Any curiosity questions that you want to ask before we end?
Let
Emily.
me see. So what's the like your favorite thing about what you do? Either or
Helping
both
people.
of you?
That's an easy question. It's helping people because
Yeah.
I think everyone's gotten involved with some type of job where you had that nightmare boss and not necessarily liking what you do. I had a boss, I wanted to punch him in the nose. He was one of those guys who talked down to you and condescending and cuss at you and stuff. And you're getting paid really
Yeah.
good, so you just suck it up and smile. Uh, and hope you meet him in a dark alley one day. Well, this thing is beautiful because it's a great organization. I don't know if any of the people watching this or on this call are people of faith. I am. Almost all the people running this organization are, you know, faith faithful people, um, you know, believers and that sort of thing. So that's just something that personally appeals to me. But the fact that you are actually able to help everyone involved, there's no downside, there's no negative, there's no one, being hurt in any way, shape, or form. This is purely an opportunity to help people. That's what's so cool about this.
Well, for me, I've been on the journey of health and wellness all my life. Like the first incident with me was when I was 15. I put too much salt in some oatmeal water, the water I was boiling to make oatmeal, and it gave me a headache for 3 days. I haven't used salt in anything that I make for me or anything since then. And I learned to drink a lot of water I wasn't very big ever, but when I saw the little tummy coming out when I was 14, I was like, oh no. And I started drinking all this water I just had a little tummy. I've never been big as a minute. So, but just the point, the health and wellness journey is wonderful. And so that's why I love EHP. It's because it's a health and wellness journey and we all need to be concerned about our health. Why live this life without being as healthy as we can be? We need to, I mean, I don't want to walk around hurting and in pain because I drank all this soda today. And I just don't want
Yeah.
to live that life. And it's a struggle every day, don't get me wrong. But I love what Scott and them are doing in the journey and to help people save money and to be well. What more do you need?
Yeah.
Come on.
So
Right.
so Scott, I think you said something about Something about like helping schools. You say something about helping school. So I am a part of a nonprofit organization. Nonprofit organization that's out on the East Coast, but they're all about kind of education and of like high school students and families and that kind of thing. I don't know if this would be something like if their school districts would be interested in, but if you're interested in, we could maybe do some kind of connection there.
Yeah,
But
absolutely.
I
Share
just
some.
thought of that, but yeah,
Yeah, you have my emails for sure. Share whatever information you
okay,
can, and let's see if there's a there there.
yeah,
Yep. Just do 15, 20
Mhm.
minute qualification session. That's what you do.
yeah,
Yeah,
yeah. So,
and Emily, you'll make sure on the replay that their all their contact information will be there
I
on
can
the
put that in
replays.
there. Yeah.
Okay. That way there,
All
when they
right.
watch the replays, if they miss hearing it, they'll have the emails
Exactly.
at their disposal. So, all right, well, I want to thank both of you for coming. It's
Thank you for having us.
been a true enlightening experience.
I
Yes.
appreciate you guys. Thank you for having me.
Thank you.
Awesome. You guys are welcome back
Um,
anytime.
all
And I
right.
will be in touch, Scott.
All
Okay,
right.
sounds
Thank
good.
you.
Thanks, John and Emily. Thanks, Cymona, for setting this up. You guys have
All
a
right.
great weekend and 4th of July.
You too.
Yes.
You,
Goodbye.
you too.
See you guys.
And everybody out there listening, thank you for tuning in. Hope it was educational for you. And I'm here every Friday, as they say, live at 5 Eastern, 4 Central, and 2 Pacific. Go on, like I said earlier, go onto my YouTube page, go onto YouTube, type in Mill City Marketing MA. Most of my previous podcasts will be there. When you do, like and subscribe, and you'll get notified every time a new one's posted. If you want to get a hold of me, my website's right up above me here, millcitybusinesshelp.com with one S after business. My email is millcitymarketingma@gmail.com. And get a hold of me that way. If you want to come on my podcast, get a hold of me and I'll send you my calendar link. You can set up a time to talk. That's about it for me, Emily. Wanna close us out here?